C5, C6 disc herniation, or even C5, C6 disc bulge. Either way, a painful condition that creates a lot of discomfort and disability for many people. If you've ever been diagnosed with this condition, or you have any of the symptoms that we're about to talk about here in a couple of minutes, or maybe you have an MRI report that shows that you have a C5, C6 disc herniation, then this video is for you. In this video, I'm going to discuss exactly what is a C5, C6 disc herniation, the symptoms it can cause and how it affects your body, and most importantly, I'm going to give you the 5 best exercises that I found help people recover from this problem, as well as I'm going to show you how to do them safely and effectively. Hi, my name is Dr. Scott McCrimmon, and I'm a chiropractor practicing in Caledon, Ontario. Over the past 20 years, I've been fortunate enough to help thousands of patients with varying health conditions in our office recover so that they can live pain-free and enjoy their best life. This channel is dedicated to giving you the information on these various health conditions that we see in our office so that you and your family can be pain-free, function your best, and live life to the fullest. A C5, C6 disc herniation is a very common source of neck, shoulder, arm, and back pain. The most common symptoms that we'll see with a C5, C6 disc herniation or disc bulge are pain and stiffness in the neck, pain in through the shoulder, and down our arm, potentially all the way to our fingertips. The most common spots you'll see in the arm are the back of the arm, across the forearm, and down into the first 2, maybe 3 fingers. Now this can present as pain, burning, numbness, tingling, even weakness, like trouble lifting up your coffee mug or grasping at things. Okay? The pain can be electric-like or sometimes a dull ache that just won't go away. Another spot that's very common to see pain with a C5, C6 disc herniation is in your back on the same side, right by your shoulder blade. Okay? Sometimes that is the only spot or the most noticeable spot for patients as well. Now, before I get into giving you my 5 best exercises to help with this problem, let's understand what exactly is a disc herniation and how it creates these symptoms. Okay, so for those who have never seen one before, this is a spine. In our spine, we have 3 main parts that we look at. So this curve here is our neck, this curve here is our middle back, this curve here is our lower back, and at the bottom sits the sacrum. For the purpose of today's discussion about C5, C6 disc herniation, we're going to be talking about the neck. Now, the important parts that I want you to know in the neck is we have the bones here. There are vertebrae. They're what give us our spine, our structure, and protect our spinal cord inside. Okay? In between the bones, we have our discs. So when we talk about a disc herniation, this is the structure we're going to refer to. And also, really importantly, we're going to talk about these yellow things coming outside, and they're our nerves. Okay? The way our body communicates is our brain sits up here. I always say, at least hopefully for most people it does. And it communicates with our body by sending signals down our spinal cord, which is the yellow that you can see inside. Okay? Our spinal cord's job is to protect that spinal cord. And then it sends signals out these nerves. Okay? The nerves happen to go right by the discs. So when we talk about a C5, C6 disc herniation, we want to look at what is the structure of a disc. So as I mentioned, the discs are these pieces of cartilage that sit between the bone. I'm going to flip this up on its end, and you can see a disc, in a way, kind of looks like a jelly donut. It has a hard outer surface, and inside it has this jelly called the nucleus, which usually is just sitting nicely right in the middle like a nice little circle. What can happen over time, due to various causes that we'll talk about in a second, is this jelly, as you can see here, starts to make its way towards the outside. Okay? If this jelly, as I say, squishes out of the donut, which I'll show you an example of here, okay, so you can see that that jelly is squished right out of the donut there, that is what we call a disc herniation. So the nucleus or that inner jelly material has squished out, has herniated out of the disc. The jelly and the nerve, they don't like each other. So when the jelly hits the nerve, we often get pain wherever that nerve goes. Now, the nerves from our neck, they're the ones that go all the way down our arm to our fingertips. Okay, they also have branches that go through the back there. And depending on what level of the spine is affected, okay, each nerve supplies a very different spot in our arm and our back. So I'm going to show you that here in a second. So we label each of these nerves coming out of our spine relative to the vertebrae that are near them. So we have 7 cervical vertebrae, so that's our C1, C2, C3, C4, C5, C6, C7, okay? And the nerves that come out of them, there's actually 8, so we call this nerve C1, C2, C3, C4, C5, C6, C7, and C8, okay? So when you hear C5, C6 disc herniation, it's talking about the disc between C5 and C6, and that disc most often, but not always, affects our C6 nerve, okay? So as I mentioned, each nerve supplies a very specific spot in our arm. So as you can see by this chart, the C6 nerve supplies across our forearm and into the first 2 fingers. Now, depending, sometimes that disc herniation could affect a different nerve, okay? So depending on what nerve it affects, you may have symptoms in that part of the arm. Now, not only does each nerve affect a certain part of your area as far as pain goes, like we showed with that chart, it also affects certain muscle groups, which is why you may have weakness in certain activities, again, depending on which nerve or group of nerves are affected. That will determine what type of weakness you have or where your pain is going to be. So how does this happen? Well, most often it's a chronic postural issue, wear and tear issue. Yes, it can happen from acute injuries like car accidents, whiplashes, ski injuries, falls, sports injuries, anything like that. Okay, you can have the acute injury where that jelly squishes out of the donut. Most often, this happens from chronic overuse or pressure or wear and tear on the disc. What I mean by that is I'm going to go back and show you our neck curve or our cervical curve, as we call it. So you can see here, if I put pressure down on this curve, it's got a bit of a spring to it. The stress is going back on the joints where it's supposed to go, where it's designed to be. Because all day long, gravity is squishing us down. Now, because in our world today, most of our life is like this. We have phones, we have computers, we sit and watch TV, we drive a lot. That tends to do this to our spine. Okay? So as that spine creeps forward and we lose that curve, you can see now when I put pressure down, one, it doesn't have that nice spring that it used to. But if you can see, now the stress seems to be up more on the discs, okay, as opposed to when we have that normal curve or lordosis in our spine, where that stress is now back on the joints where it's designed to be. So over time, like anything, if you put stress on something over time, it's going to start to wear down. So when, as chiropractors, we stress the importance of posture, this is one of the reasons, because it can create wear and tear through our discs, through our joints, through our vertebrae, which can cause the disc to break down, allow that nucleus or that jelly to squish out, and then we end up with a C6 or C5-C6 or even C6-C7 disc herniation. Okay, so let's talk about the 5 best exercises that I find that you can do at home to help yourself with a C5-C6 disc herniation. Now, before we start, it's important for you to note that these exercises are for demonstration purposes only. It's very important that you discuss with your healthcare provider whether these exercises are right for you and they are appropriate for the treatment plan that they are providing for you. Also, none of these exercises should create pain. If you have pain doing these, we ask that you stop, reconsult with your healthcare provider, and again, make sure that you're doing them properly and that they're appropriate for you. So, the number one exercise that I always start with patients is just purely posture. We talked about already how having this rounded shoulders and forward head posture puts more pressure on the discs, which is going to put more pressure on the nerve, which is going to create more pain and discomfort for us. So what we want to do is we want to work on bringing our shoulders back and down. That's often a very relieving posture for people. So if you look at it from the back, we say bring our shoulders together and down. We almost use this W position. You can put your arms out like this. So we go together and down. You're going to hold that for a couple seconds. Now, I wouldn't expect anybody to walk around all day puffing their chest out, but again, 5 to 10 repetitions of just back and down, hold for 10 seconds, okay? That will often be a relieving position for people, and it gets us out of our postures during the day where often we're sitting at our desk, we're rounded, we're in our car, we're rounded. These are all the things that will put pressure on the disc and the nerve, so we want to open this up and bring them down. So a simple back and down postures, 5 to 10 repetitions whenever you remember throughout the day can be very helpful. The next thing we want to do is we want to make sure the joints in our neck, our spine are moving, they're lubricated to allow that stress to come away from our C5-C6 disc herniation. So when we look at range of motion, our neck has 3 different planes of motion. One is our flexion and extension, one is side bending, shoulder to shoulder, and the other is rotation, right to left. So we want to run our neck through these ranges of motion. Again, 5 to 10 repetitions in each plane in a pain-free range. So our flexion extension should look like this. So we come forward and we look up. We come forward and we look up. Again, 5 to 10 repetitions in a pain-free range of motion. The next one we're going to do is ear to shoulder, so side to side, right and left, okay? This is gonna help lubricate our joints. Again, 5 to 10 repetitions in a pain-free range. Now, you may find, especially with the side to side and even some of the other ones, you may find going to one side might actually put more pain down your arm, and going to another side might actually take pain out of your arm. I want you to favor, if that happens with you, we always say favor the side that takes the pain out of the arm. So if you find leaning to one side takes the pain away from the arm, then we want you to work a little more in that range and avoid the range that puts any discomfort down your arm or even into that spot in the back that we mentioned earlier. Okay, so we've got front to back, we've got side to side, and then we look at our rotation, one side and the other side. Again, one side and the other side within a pain-free range to get those joints lubricated and get them moving. The next one we look at is our resisted range of motion. Okay, so all the same planes, but now you're going to work what we call an isometric exercise, meaning you're going to apply force, but nothing's going to move. So if we look at our flexion extension, you're going to put your hand on your forehead and you just push in, 1, 2, 3, 4, 5, push back, 1, 2, 3, 4, 5, push forward, 1, 2, 3, 4, 5, and push back, 1, 2, 3, 4, 5. The idea there is to activate those muscles because our muscles are what are going to support our neck. We'll do the same thing side to side. So again, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. And what I'm doing there is I'm pushing with my hand into the side of my head and pushing my head back into my hand. But if you notice, nothing is moving. So same if I do rotation, I can put my hand here and try and turn over that shoulder, 1, 2, 3, 4, 5, and same the other way, 1, 2, 3, 4, 5. Again, pain-free ranges, okay? None of this should, again, be uncomfortable. You should just feel the muscles working a little bit. We want to start to strengthen some of those stabilizing muscles for our neck, okay? The next one we're going to look at is what we call a chin tuck. So a chin tuck, if you look from the side, is bringing our chin and we're bringing it straight back, almost making a double chin. So it's here and here. Okay, and if you notice, my chin is staying straight on. I'm not going up, I'm not going down. We're gonna come straight back. And what you should feel is often you'll feel some of these muscles tightening up in here, and you may feel a stretch or a pull back in here. That's where you should feel everything working. Again, shouldn't be pain, shouldn't be shooting pain down our arm. So again, we're gonna do our 10 repetitions of this, 5 to 10 reps. So in, 1, 2, 3, and back out. In, 1, 2, 3. Okay? That's a really great exercise for working the stabilizing muscles of our neck. Okay? I have one more exercise to show you. I'm just going to grab a towel so you can see what we're doing here. Okay, so the last exercise I'm going to show you, which is a very, very effective one, is get you to grab a towel. And what we ask you to do is you're going to put the towel behind your neck, like this. You're going to pull forward, and you're just going to tilt your head back over the towel. So you actively have to do some work, and you are providing resistance with the towel. And you can change the angle. So lower down in your neck, you can pull a little bit more down and extend your head. You can move up just a little bit so your head's a little more neutral. And come back, and you can even move up a little bit higher where you're going to pull more up towards your eyes and lean back. So again, 5 to 10 repetitions. 1, 2, 3, 4, 5. And I am giving a bit of force pulling forward so that my neck does have to work against that. And I like to do it again in the middle. 1, 2, again, 5 repetitions there. And then one more a little higher up where my hands are pointing up. And I work there. For C5-6 disc herniation, the lower part of your spine is usually where you want to focus, but you can do those 3 ranges there. Again, as always, pain-free, comfortable ranges of motion. This is going to help keep those joints moving and take some pressure off of that disc. Well, I certainly hope you enjoyed that video and you found it valuable. As a reminder, always consult with a healthcare practitioner and make sure that these exercises are appropriate for you and your C5-C6 disc herniation, but I do find them very helpful with patients in our office. I hope you enjoyed it. I hope you found it informative. If you did, please click the like button, subscribe to our channel so you can get the latest up-to-date information as we put out more and more videos on the common health problems that we see in our office. And make sure you turn on that notification bell so you can be the first to know when we put out a new video on a regular basis. Have a wonderful day.